Welcome, everybody, and thank you for joining us. That song you just heard, by the way, Talking About a Revolution by Tracy Chapman, was one that she wrote when she was just 16 years old. Uh, Appreciate her opening us up this evening. My name is Wendell Potter. I'm president of the Center for Health and Democracy, perhaps better known as a former health insurance company executive. I was vice president at Humana and Cigna altogether for about 20 years. And I became a whistleblower. What I saw during my 2 decades in the industry, what I saw was a broken healthcare system, and that led me to become not only a whistleblower, but a reform advocate. And I've been doing this advocacy work ever since 2009 when I first testified before Congress. What I saw in the industry and during my 20 years there was people getting health care in animal stalls and horse stables. I saw families destroyed by grief after losing a loved one. I saw executives shrug their shoulders while people suffered. And I saw shareholders celebrate good earnings reports while their mothers grieved their children. One of my responsibilities at Cigna was handling financial communications to the media. My name was on Cigna's earnings reports for 20 years. So I knew how that company and all these companies make money, where it comes from, and what they do with it. Throughout my career, I've seen our healthcare system fail working families, fail middle class families time and time again. I've seen more and more people demand that we fix our broken healthcare system, especially in recent months and years. In fact, in all of my years in healthcare, I've never seen something that has developed uh, that has attracted so much anger as we have seen with the way that United Healthcare, in particular, United Health Group, operates. A company that's become so big and dangerous. And that's what we're here to talk about tonight. United Health Group is not just an insurance company. We may think of it as an insurance company, but it is actually the largest healthcare corporation in the world. And in fact, it has gotten increasingly into healthcare delivery. For years, a few of us have been warning about United's efforts to buy up physician practices as it has gotten more and more into healthcare delivery. More recently, people have been paying a lot more attention to that company's role in controlling pharmacy benefits. It has one of the largest pharmacy benefit managers in the country, uh, along with Cigna's PBM and CVS Aetna's PBM. Those three companies control 80% of the pharmacy benefit management business. But now we have a first ever look at exactly how one company grew to control nearly every part of the American healthcare system, or to be a significant player in just about every part of the system. So our team is proud to release, when I say our team, the Center for Health and Democracy, we're proud to release the Sunlight Report, a first of its kind analysis of United Health Group's nearly 2,700 subsidiaries. Our researchers uh, looked at each of those subsidiaries, classified it, and analyzed how United Health has grown to dominate our healthcare system in the way that no other company has ever done. In truth, United is always buying and selling companies, so that the number that we reported when we released the Sunshine Report, I think it was exactly 2,694. That number likely has fluctuated because the company has bought and sold companies since then. It very well could be over 3,000 subsidiaries at this point. The Sunlight Report sheds a light on how the biggest healthcare company in the world has become vertically integrated. When I was in the industry, Cigna and Humana grew, and all the companies in that business grew largely by buying up smaller competitors. But they, in recent years, began to embark on what is referred to as a vertical integration strategy, getting increasingly into healthcare delivery to the point that United's healthcare delivery unit, which is under the umbrella of Optum, uh, is actually more profitable, makes more money for the parent company, United Health Group, than United Healthcare, which is the insurance arm. So it is certainly not just an insurance company by any means. It's a very, very large healthcare conglomerate. Vertical integration is a term that you'll hear a few times tonight, but one that I don't think many people are all that familiar with. Vertical integration means that more and more providers are, excuse me, that it means that more and more of the company comprises physician practices, it comprises clinics, the pharmacy benefit manager, as I mentioned, and a lot other parts of the healthcare system that and even I was not even aware of. The company has increasingly gotten into the media business as well. It controls a significant part of the way that we get healthcare information and even how we choose our healthcare providers and who we decide that we can trust and would want to choose as a doctor or hospital. That is the how this company has grown and how it's gotten increasingly into our healthcare business or our lives. I'm going to turn it over now to Joey Rotino, who is part of our team. He's worked with me now for 9 years. He is the person who took all this data to try to make sense of it, to make sure that we were telling the story in a comprehensive way. We were categorizing the company's many subsidiaries correctly. So, Joey, take it away and help us explain how this company really operates.
Thank you, Wendell. And before I get started, I just want to say it was really incredible to work on this project and see it come together. And, all of our team is just so excited that folks are interested in the findings. So thank you all for joining tonight and listening in. So for my section, I'm going to tackle 3 areas before passing the mic. First, I'll tick through the different ways we categorize the type of entities UnitedHealth has. Then I'll zoom in a bit and highlight 3 of UnitedHealth subsidiaries and what they do. And finally, I'll touch on how we did the project and how we got all of this data. So to start, we found that UnitedHealth Group is made up of nearly 2,700 separate entities. And again, you can see all of them listed on our website, sunlightreportinsurance.com. We broke the subsidiaries or entities more generally up by 5 main categories: clinical, insurance, pharmacy, international, and the catch-all grouping that we call other. Most folks, as Wendell said, just think of United as a health insurer, but you can tell from this pie chart that it's much, much more than that. First, clinical. United has over 2,000 clinical enterprises, which has led the company to own or have close contractual ties with 1 in 10 US doctors. For its insurance arm, it touches around 50 million people with its commercial plans, as well as its Medicaid, Medicare Advantage, and VA businesses. You have United's pharmacy business type, which provides drug benefits for roughly 60 million people in this country, which translates to about 20% of the pharmacy benefit market in the US. Its international operations span all across the globe. You can see from this map in pink that they have businesses in Canada, all over Latin America, China, Australia, and elsewhere. And here's a really interesting listing in the international bucket. United has an entity called Exploration for Mine Clearance, which is located in Iraq, which clearly is not a health insurance company based off its name or really a healthcare related at all. At least it doesn't sound like that to anyone on our team. And then I'll touch on our 5th business type, which is other, the catch-all. And that includes consulting, education businesses, media, and venture capital entities. And now we're going to zoom in a bit and look at some of the subsidiaries themselves. First, we'll look at RVO Health, which is a joint venture between Red Ventures and United's Optum, which United has the controlling stake in that company. RVO Health publishes sites like Health Grades and Healthline, which get 300 million views or visits each month. So like folks are on these websites, and I doubt that they know that it has a controlling and the controlling entity in it is United. Landmark Health, which was purchased by United in 2021. This company was a leading provider of in-home healthcare services. So again, part of patient delivery and not part of like a health insurance business as we think of United Health. United acquired it for $3.5 billion that year. And then we have Change Healthcare. Change was acquired for a whopping $13 billion in 2022. And as many of you know who are listening on this call, was involved in a cyber attack last year that exposed 190 million people's healthcare and medical data. Plus so many more entities. So if you haven't, please dive into our site and see the lists and lists of other entities, subsidiaries, and acquisitions that I haven't been able to touch on. I don't think there'd be enough time in this webinar or any webinar to sit through all of them. But before I pass the mic over, I would just want to talk about how we got all of this information. The data in the report is based on United Health Group's own Schedule Y filings, which are filings that companies are required to file with state regulators. So anybody can look at our source data, anyone can look at these PDFs. Schedule Y documents are long and they're not pretty, but all of the information is there. So again, thank you everyone for listening in. I'll jump on in a little bit for some questions at the end. But please check out our website and our social media accounts for helpful graphics and videos. Share them far and wide. And with that, I'm going to hand it over to Dr. Rachel Madley, who's the Director of Policy and Advocacy for the Center for Health and Democracy. Again, thank you all for joining, and thank you, Rachel, for taking the mic.
Thanks so much, Joey, and it's great to be with all of you tonight. I am going to take us all through what does United Health Group's empire mean for the typical patient moving through the healthcare system in the US. So we're going to look at all of those different steps, and I have some slides that I'll show to show each step there. So when you think about the patient's healthcare journey, I want you to keep in mind that every step that I'm highlighting here, United Health Group is profiting in some way. So, when you are initially looking for healthcare, many people are needing to find a provider, so they will go on to the internet. A lot of people use healthgrades.com, which is something that Joey mentioned. And again, this is like the Yelp of medical providers, right? It has reviews, it has information about if they take your insurance, things like that. Looking at this website, you would almost never know that they are owned by a subsidiary of United Health Group. The website itself actually says that over half of all Americans who saw a doctor in the last year used health grades to research medical providers. So again, you are going to find a doctor and it's controlled by United Health Group when you're looking for that doctor. Now, when you actually go to visit the doctor, again, there is about a 1 in 10 chance that you will be seeing a medical provider who is either employed by Optum, which is a subsidiary of United Health Group, or has close contractual ties. Sometimes you can tell if these medical providers are employees of Optum because the clinic may be named Optum or something similar, but many times it's nearly impossible to tell if your medical provider is an employee of United Health Group or has close ties with them because a lot of these subsidiaries are named things like American Health Network of Ohio or the Polyclinic in Washington State. So, after you go to a doctor, you may receive a diagnosis, and like many people these days, you are likely going to do some research on that diagnosis on the internet and try and find out, what does it mean for you, your healthcare? What are the treatments that are recommended? I know I did this when my son needed ear tubes for recurrent ear infections. And actually, the top hit that I got when I searched the procedure he was going to get was healthline.com. Now, again, looking at this website, it's impossible to tell. However, this website is again owned by and controlled by a subsidiary of United Health Group. So, what looks like a neutral presentation of medical information is actually again a part of United Health Group. Now, not only Healthline, but also Medical News Today is part of the same subsidiary of United Health Group. So, even when you're researching, treatments, you are still getting information that is put out there by United Health Group. Now, let's say you need something like a surgery or a procedure done. When you are getting treatment, there are a lot of ways that United Health Groups, through its insurance arm, United Healthcare, is going to exert control over that process. For example, if you're one of the 50 million people who has United Healthcare insurance, you are going to be subject to a lot of their utilization management requirements. This can be prior authorizations for procedures that are recommended and prescribed by your medical provider. It could also be a denial of a claim for a procedure that you already received. Now, even if you don't have United Healthcare, you may still be subject to the prior authorization processes that United Health Group has put together through a program and subsidiary called NaviHealth, which has become a widely used AI tool to review prior authorizations and unfortunately to deny many of those prior authorization requests. So even if you chose not to have insurance through United Healthcare, United Health Group is still potentially helping process your prior authorizations through that NaviHealth tool. Now, let's say you need a prescription. You are, again, potentially running into a subsidiary of United Health Group trying to get that prescription through their pharmacy benefit manager arm, which is called Optum Rx. Within that, we actually found that they have over 20 different pharmacy benefit managers. Now, pharmacy benefit managers act as a middleman in between the insurance company and the pharmacy, and they are often known for doing things like marking up the price of drugs, but also requiring that patients try a cheaper drug than the one that their doctor prescribed to prove that it doesn't work or fail first before they let the person get the medication that the doctor prescribed. And the people that are served by United Health Group's PBM Optum Rx is actually 66 million people in the country. So even if you don't have United Healthcare, there's 16 million additional people who are getting those benefits through United Health Group. So again, just a massive amount of control being exerted over your healthcare journey. Now, let's say you or a loved one needs care in a nursing home. United Health Group has a lot of involvement in the nursing home industry. It was recently reported by The Guardian that United Health has put employees into nursing homes that are medical providers, and these employees are involved in programs with the nursing homes to try to reduce hospital transfers. This can be in the case of someone showing signs of a potential stroke. Normally, the nursing home would transfer that person to the hospital to get the best, quickest care that they can. These programs either delay or totally stop that transfer from happening. And the point of this here is that the people who would be transferred to the hospital have United Healthcare insurance. And obviously, getting care in a hospital for a potential stroke is very, very expensive. That's going to require United Healthcare to pay out a lot of money in claims. This reporting also found that these United Health employees who were within these nursing homes and in this program also would try to convince nursing home residents to switch their code status, which is essentially directions to medical providers of what to do if your heart should stop beating, from full code, meaning the medical providers are going to do everything that they can to keep you alive and resuscitate you, to do not resuscitate, which means that they will let your heart stop. And this again is because a full code procedure costs a lot more money than a do not resuscitate procedure. And in this case, United Healthcare would not have to pay out that money in those claims. Now, let's say either after the nursing home or instead of a nursing home, you or a loved one need home care. United Health Group, as Joey mentioned, is very involved in home care organizations. They have a lot of subsidiaries, including Landmark Health. And you, as a caregiver or a patient, may again go into this knowing, hey, I've heard some things about United Health Group. I'm going to try and steer clear and choose, a small independent home care provider. It's almost impossible, again, to know that United Health Group is either has a controlling stake or fully owns these home care organizations because they are called things, as you see on this slide, like almost family personal care. So again, United Health Group has a huge impact on people's care, even if they don't want it to or don't know that United Health Group is involved. Now, I want to highlight what this means for veterans. Not every patient is a veteran, but United Health Group is very involved in veterans healthcare. And this is in two ways. The first is United Health Group has a subsidiary called Optum Serve. This program administers what is called the Veterans Community Care Program for about half of the country. This allows veterans to get care outside of the VA for specialty care that's not included, that's not available at the VA. There is extensive evidence from the Department of Health and Human Services, Office of the Inspector General, additional researchers, and things like that, that Optum Serve upcharges, double bills, and upcodes for the programs that they administer within the VA. So they are essentially using a lot of the abuse tactics that are used in the Medicare Advantage program in this VA program. To make matters even worse, the United Health Group has developed Medicare Advantage plans that they call the Patriot Plan, and these are advertised as plans that are specially tailored to meet the needs of veterans. Unfortunately, there is a profit-seeking motive behind this because what United Health Group has observed, and many other folks have observed now, is that if you have a veteran who is eligible for healthcare through the VA and also eligible for Medicare Advantage, they are going to get a majority of their healthcare through the VA. However, if they enroll in a Medicare Advantage plan, that private insurance company that's administering that Medicare Advantage plan still gets the full payment from the government, under the assumption that that person is going to get all of their care in the Medicare Advantage plan. So in this case, United Health Group is essentially double dipping if you have a veteran who is using the Optum Serve program within the VA and who is also enrolled in the Medicare Advantage Patriot plan sold by United Health Group. Now, finally, even if you do not have United Healthcare as your insurance, you don't have Optum Rx as your PBM, and you steer clear of any providers that are owned by United Health Group, you are likely still impacted by them in your healthcare experience. This is through Change Healthcare, which is one of the subsidiaries that Joey highlighted. Now, Change Healthcare is involved in a very large majority of healthcare transactions that happen in this country, often through things like payments from health insurance companies to providers, things like claims processing, and other entities like that. And so Change Healthcare has a lot of control over your data of what care you're getting, what payments you're making, things like that. So even if you try to avoid United Health Group, it is still involved in your healthcare access. So as you can see, It is a lot of involvement of United Health Group in our healthcare system. And what I said at the beginning, I really want to emphasize United Health Group is profiting at every single point in this United Health Group land, if you will. They are making a profit off of your attempt to get healthcare through all of these different steps and through all of the subsidiaries that they own. And so, with that, I am really excited to introduce Andrea Kim. Andrea is a caregiver with firsthand experience dealing with United Health Care and Health Group. She fought the care obstacles that United Healthcare put in her way in her individual situation and is now fighting to change the system to make sure that others do not have to go through that. And Andrea is going to share her story with us, and we are so excited to have you on this webinar. So I'm going to hand it over to you. Thanks, Andrea.
Thanks, Rachel. And hello to everyone on this webinar. Thank you for your time. As mentioned, I'm Andrea, and I am here today to share my experience in becoming the primary caregiver for my late father, Michael Kim, a brain injury survivor, lover of karaoke, father to 2 daughters, and a United Healthcare Medicare beneficiary. In 2023, as dad, or appa as I call him, which means dad in Korean, was found in the middle of the road with a severe traumatic brain injury that damaged his frontal lobe. Overnight, this horrifying injury stripped away much of the amazing person he was, along with his independence, his ability to walk, talk, his memories. Almost everything was wiped. And while he would never be the same, he was never a lost cause. But the only chance that we had to give him a semblance of a humane and dignified remainder of life so that he could rejoin his daughters was through intensive medical care and rehabilitation, or what's called inpatient rehab. But under his UHC Medicare Advantage plan, that was impossible to secure. I was fortunate, or I guess what we call privileged in this country, to take New York paid family leave. And even though I only received 20% of my salary, it allowed me to advocate for my father, my appa, who often was the most vulnerable patient in every facility we are at. It was a 24/7 job, fighting the constant denials and delays in his care. However, with the help of his amazing care team, I got him admitted into one of New York's top inpatient rehabs. But I would never be able to keep him there long enough. But despite the odds, my appa made remarkable, some would call it miraculous progress. At his rehab, they actually called him the movie case. From initially being told that a meaningful recovery was not possible, to being able to walk 100 steps with minimal assistance, being able to feed himself, even picking up a grain of rice with chopsticks. And on some days, these very special days, he'd be able to talk to me. Once he asked me about my dating life. And on these wonderful days, he'd be able to tell me he loves me. But for UHC, that progress was still never enough, and they insisted that he be discharged to a nursing home. It didn't make sense, all of the research I did talking to professionals. So I worked around the clock with advocacy nonprofits, elder law attorneys, even used AI to better understand the complexity of his case on neuroscience and crunching dense Medicare guidelines. But once again, it was never enough. And after hundreds of calls to UHC, it eventually led me to UnitedHealth, a UHC subsidiary that Rachel mentioned, that was supposedly coordinating his care. UnitedHealth is also currently facing a class action lawsuit for their use of AI in denying claims. And they too offered me no help. Although my efforts and my pleas were often able to move the most hardened professionals, doctors, lawyers to tears, One doctor at rehab even breaking down in front of me, telling me that she doesn't want to do this anymore because she can't help us. She can't help my dad, or even the gunshot victim next door that was close to my age. But even with all of my pleas, my cases, my arguments, it would never be enough to stop the denials. And eventually, my Appa was discharged to a step down facility, as they call it, or a nursing home, where he was bounced back and forth between emergency rooms, rehabs, and steadily lost his neuroplasticity, his brain's ability to heal, losing all of the amazing recovery he made in rehab, and any chance of rejoining his daughters. And 2 weeks before the 1 year anniversary of his injury, after fighting so valiantly against both the trauma and the cruelty of this healthcare system, my Appa passed away in January 2024. I know our story sounds like another healthcare tragedy, but through it all, it has also helped me find my sense of purpose, my lifelong calling to advocate for vulnerable patients like my Appa and for caregivers like myself. The courage to leave my tech job at Amazon and to pursue a career in healthcare reform, specifically focusing on Medicare. I too will be using AI to actually support patients, and now also learning the law to change the very policies that failed my father and so many of us in this country. I actually recently joined law school 2 weeks ago. So to those listening, I know this system feels impossible, and it probably will get worse before it gets better. But resistance can take many forms. But it first begins with the belief that a better and more humane world is possible. And I may be one person, but as I've told United Health Group in countless voicemails, whether it takes me 5 years, 10 years, or the rest of my life, I will never forget, and I will never stop fighting for patients like my dad. Thank you.
Thank you so much, Andrea. That was so incredibly powerful. And we just are in solidarity with you and so thankful that you shared your story with us. And I know that so many of the participants on the call likely have experienced very similar things in this system. And I have so much appreciation for your resilience and your new career trajectory. Best of luck in law school. But thank you so much for sharing that with everyone on the call. We really, I can't express my gratitude enough.
Thank you.
And now I am going to introduce Dr. Seth Glickman. Dr. Seth Glickman was the Chief Medical Officer at Blue Shield of California, as well as Intermountain Health. He has extensive experience in both the health insurance world as well as the provider world. And as a physician himself, he has seen how vertical integration, like what we're discussing here with United Health Group, affects physicians trying to treat their patients. So I'm going to hand it over to Dr. Glickman.
Thank you, Rachel. Thank you, CHD team. Thank you, Andrea, for having the courage to share your story with us. And thank you for everybody for being here this evening with us. So I want to spend some time talking about the implications of vertical integration in the insurance industry, including and especially United Healthcare, and how that impacts our understanding of how our healthcare resources are being spent. And I want to do that in the context of the medical loss ratio because I think it's one of the biggest hazards of vertical integration in the insurance industry. And so just to review, I think most folks are familiar with the medical loss ratio, but this is the percentage of insurance premiums that must be spent on medical care and related quality improvement. And the MLR was codified in the Affordable Care Act, and it pertains to a broad array of insurance products, including Medicare Advantage, commercial insurance, Medicare Part D. And depending on the actual product, there's a requirement that a minimum of 80 to 85% of the overall expenses or premium dollars go towards medical care. And the goal is to obviously increase transparency and quality because we want the resources being spent on the care and coordination for the care for patients. And obviously, some goes to overhead, but we want our goal is to prevent excess profit taking with this legislation and related regulation. And it requires insurers to disclose their MLR along with all of the things that go into the numerator and the denominator at the end of each year. And if they exceed the MLR requirements, they're required to either refund or rebate that money to the government or to consumers in the form of rebates. So it all sounds good and is very well intended in practice. But where the rubber meets the road, the reality is that with large vertically integrated insurers, especially UnitedHealthcare, there are numerous opportunities to camouflage um, the overall medical expenses, and it really impairs our understanding of how the premium dollars are being spent. So, as an example of how this works, approximately one-third of the revenue of United Healthcare now is generated from doing business with internal entities like the ones we've talked about, especially Optum. And so what that means is there's a tremendous opportunity then for organizations like United to pay themselves for services. And a really important part of doing the accounting for that is how do you value those services? And they should be based on fair market value. But you can imagine when you're paying your own providers or you're paying an organization like Optum to do care management, you have a tremendous opportunity to obviously set rates that actually are in your own best interest as it relates to the medical loss ratio. So, for example, if you're paying your own providers for provision of care and you set those rates higher, then it actually appears that you're spending more on medical expenses as it relates to the medical loss ratio, even though a significant portion of that money is going towards overall group profits. And so there's lots of opportunities to leverage transfer pricing to manipulate the numerator and denominator in the medical loss ratio expense calculation. Another important concept is the what we call intercompany eliminations. And this is essentially an accounting method. So companies like United that have a lot of internal entities and are doing business with one another don't double count revenue and expenses. And it's designed to ensure that we can get a holistic look at the entire corporation and understand what is the overall group revenue and profit. And this is obviously very important for investors and outside parties to understand how a company is functioning. Where it breaks down, though, is at the entity level, particularly on the insurance side, where the medical loss ratio is calculated and reported. Things like medical expense, it appears, are going towards the provision of care, even though they're going into a lot of other buckets that are driving the overall profitability of the company. And so there's really no good optics around how those intercompany transfers are working. We just see the output, which is often an engineered medical loss ratio formula. And so the result of this is because we have less transparency, it gives for-profit, vertically integrated insurers like United more power, and it ultimately results in higher premiums for patients and consumers, and again, less transparency overall for the entire healthcare system. And so that's a brief summary of how the medical loss ratio is impacted by large insurers that have the ability to move money in a lot of different ways internally and optimize or engineer their reporting of medical loss and the money they're spending on medical expenses versus profits. The other thing I want to talk about is outside of actually calculations about medical loss ratios is the the notion of what this actually means on the ground for physicians and other clinicians who are doing their best to care for their patients and what it means for the practice of medicine. And the easiest way to think about it is that when you have a vertically integrated corporation like United, the corporate priorities are ultimately what drives day to day, even decision making by clinicians. And I'll highlight two examples. One relates to the notion of how a primary care physician provides services for their patients. A lot of it has to do with the network of other collaborating physicians they work with, specialists like cardiologists, and their ability to refer to those patients that team with them in providing great care to their patients. Often, primary care physicians will select a specialist not only based on the quality of care that they provide, but also the level of communication. Is it timely? Can the patient get in quickly to be seen? Is there closed loop communication about what the care plan is? And very often, what happens in corporations like United is that the network is constantly being essentially refined to reflect preferred providers and more commonly now employed providers. And so it becomes very hard for primary care physicians to leverage historically what their networks look like in caring for their patients. And it becomes increasingly difficult for any independent physician to uh, to survive, let alone really thrive, because they're increasingly excluded from networks in favor of employed physicians that are part of large Optum practices. So really limits the flexibility of physicians on the ground. And the other area is really related to physician compensation. So much of the decision making becomes influenced from incentive plans that physicians are subject to that are tied to corporate priorities, a lot of them related to total cost of care, utilization. And so it really starts to impact how decisions are being made on the ground and also influences and impacts the autonomy of clinicians and affects their ability to care for their patients in the best way that they know how to do. So those are just some of the real world implications of a vertically integrated insurer like United. And I want to turn it over now to Wendell, who's going to share some additional thoughts to conclude today.
Seth, thank you very much for sharing your insights and shedding a light on the impact of this vertical integration on all of us. Uh, I want to thank the entire team. We will have time, by the way, for Q&A. So please get ready to use the Q&A feature in Zoom to if you have questions this evening. But I also, again, want to thank the team and Arnold Ventures for helping us to be able to do this work. I want to thank some of the partners that we've worked with, the Loop Coalition, the Reclaim Medicare Coalescence that joins us in advocacy for changing this healthcare system that's so badly broken. And I want to thank Andrea, certainly, especially for her willingness and courage to tell her story, and for changing her life to be an advocate for change, and to go to law school to try to figure out how she might, as a lawyer, be able to do that. Her story, by the way, reminds me of my own mother's situation. Mom was enrolled in a UnitedHealth plan, not by choice. She didn't enroll in it. She initially enrolled in a John Deere health plan many years ago. Yeah, John Deere was in the MA business, but it was one of the many companies that United acquired. Mom broke her hip and needed rehab, just like Andrea's father did. And we found out that the provider network was very inadequate. I was able to get mom out of that MA plan, which is not easy, by the way. She was able to finally get the skilled nursing care that she needed. But This points out that one of the failings of managed care or Medicare Advantage plans is often they have very inadequate provider networks. Not only are they notorious for using prior authorization to deny coverage for needed care, often it's very hard to find a provider anywhere close by that is quality. Uh, I also want to say that I'll let you know that we have been sharing this report on Capitol Hill. We've had briefings on both the House and Senate side. We've met with a number of individual offices, both Republican and Democratic offices. One of the members of Congress who has been a long champion for healthcare reform, Congressman Lloyd Doggett, has been very interested in our work and certainly in the work we've done as it pertains to Medicare Advantage. And he's going to be sharing some of his comments with us momentarily. Congressman Doggett, as you may know, represents the 37th District of Texas. He has long been a leading voice in criticizing Medicare Advantage. I met Congressman Doggett during the debate on what became the Affordable Care Act. He's been a longtime champion of reform. He's the chair and founder of the House Affordable Prescription Drug Task Force. He has fought to protect reproductive rights. He recently partnered with Republican Congressman Greg Murphy and called on the Government Accountability Office, the two of them together did, to investigate consolidation in healthcare, like we have been seeing, that we've been telling you about this evening, as UnitedHealth Group has done. He and Congressman Murphy teamed up on legislation to ensure that healthcare providers are adequately paid by insurance companies for patients who are enrolled in Medicare Advantage plans. We look forward to partnering with Congressman Doggett and others who are members of the House and the Senate and both parties to try to hold these companies more accountable and to really scrutinize the vertical integration that is common now in health insurance. And the way these companies operate, frankly, is illegal in some businesses. The self-dealing that Seth in particular described is actually illegal in banking and other sectors of the economy. With that, let's hear from Congressman Doggett, and then I think after that we'll take some of your questions.
Lloyd Doggett here from Austin, Texas. Thanks to Wendell Potter, he's one of my personal heroes, and the Center for Health and Democracy for organizing this event and for this excellent report on UnitedHealth's growing monopoly. As the lead Democrat on the House Ways and Means Health Subcommittee, I appreciate the participation today and the advocacy by each of you. Together, we're seeking a more just and affordable healthcare system, one which assures every individual can exercise their human right to access comprehensive health care. We recently marked the 60th anniversary of the signing of Medicare, one of the most successful federal initiatives first signed into law by another Texan, President Lyndon B. Johnson. Medicare has offered every American comprehensive care in times of disability and retirement. Now it's under threat from both Republican schemes and corporate health conglomerates, both eager to privatize, causing many people to face unreasonable delays and denials of care, as well as higher costs. All of this is happening through a program called Medicare Advantage. I think it should be better known as Medicare Disadvantage. Medicare Advantage, or MA, is the private insurance alternative to traditional Medicare. While they receive billions of taxpayer dollars to offer coverage, these private insurers profit by limiting your choice of doctors and requiring their prior authorization before treatment that often results in delay or denial of necessary care. Despite so many promises to save taxpayer money, MA costs billions more than if the same individuals were enrolled in traditional Medicare. And too often, despite costing more, consumers are often actually getting far less. During enrollment periods, you just can't turn on a television without seeing an ad for Medicare Advantage, offering just about every benefit you can imagine, from free rent and groceries to pest control, perhaps even a Joe Namath signed football. What the slick marketing fails to tell you is that many don't even qualify for these extra benefits when you get into the fine print of the contract. Today, we're here to pull back the curtain and shed some sunlight on Medicare Disadvantage. Several independent reports have shown that UnitedHealth is the worst offender. That's why I've been demanding that the Justice Department investigate this company and take some appropriate legal action. I've also been working in a bipartisan manner with Congressman Dr. Greg Murphy to broadly investigate the Medicare Advantage program. We've called on the Independent Government Accountability Office to produce an investigative report on consolidation in MA, and we've authored 2 bills to rein in some of the abusive practices. With Medicare open enrollment soon getting underway, we have another opportunity to educate consumers on the disadvantages of Medicare Advantage. We need more energized and engaged citizens raising awareness and demanding action. Many of you may be Medicare for All supporters. I am too. Indeed, I authored the parts of this legislation that concern prescription price gouging and the need to expand coverage for dental, vision, and hearing benefits. But to achieve our vision of universal, accessible, and affordable health care, we first got to stop the corporate takeover of Medicare by these giant insurance companies. I applaud your continued advocacy. Let's never give up and never give in on assuring more of our neighbors coverage that they need. Thank you.
And thank you, Congressman Doggett. Thank you for your leadership. And I think it's worth noting that he referenced the Department of Justice. The Department of Justice and United has acknowledged this, has launched an investigation into UnitedHealth Group, and not just a civil investigation, but reportedly a criminal investigation as well, too. So thank you, Congressman Doggett. I want to turn it back over to Rachel now before we go to Q&A, and she'll touch a little bit on some of the advocacy work that we at the Center for Health and Democracy are doing.
Thank you, Wendell. Yes, so we have given you a lot of information about the problems with the healthcare system, the problems with United Health Group, and I'm going to walk through what you can do right now to push back against this giant health insurance conglomerate. So, what does all of this mean for activists? Now, we have so many folks joining us tonight from many different parts of the healthcare movement. And the biggest takeaway here is that United Health Group is affecting all of these different fights, and it is standing in our way on every fight. So, whether you are fighting to protect Medicaid, fighting against Medicare Disadvantage, fighting for better long-term care, fighting to protect your veterans' health care, or fighting for health justice, United Health Group is affecting all of those fights. And so this information, understanding it and understanding what we can do about it is really important as we fight to make the healthcare system better. So, one of the biggest things that folks can do that we're excited to share is to learn about the Patients Over Profits Act. This is a bill that will be introduced very soon by Senator Merkley and Representative Hoyle. What this bill does is it prohibits insurance companies from owning most doctors' offices and medical providers. So, this is going to stop the conflict of interest that we're seeing from UnitedHealth Group owning both UnitedHealthcare, its health insurance arm, and those 2,000 plus clinical subsidiaries. It'll get at that self-dealing that's happening that has long been illegal in industries like banking, and it will lead to less consolidation and more control over your healthcare. So, one goal is to get as many elected officials to co-sponsor this bill as possible. Now, this bill is something that has the potential to be bipartisan because again, it gets at the waste, fraud, and abuse and the lack of transparency in United Health Group. And those are two key things that both Democrats and Republicans are focusing on. And you heard Congressman Doggett talk about how he has been able to work in a bipartisan manner on some of these issues. So if your senator or your representative is a Democrat or a Republican, you can contact them and urge them to co-sponsor this bill. Now, after this webinar, you're going to get an email from us and it'll have a toolkit. This toolkit is going to walk you through a lot of different action steps that you can take. It'll tell you how to share your story with the healthcare system, similar to how Andrea did. So if you have had an experience with United Health Group or really with struggling to get healthcare in our incredibly complex system in the US, it'll tell you how to share your story. It'll also have some suggested posts for posting on social media. We've pulled out some of the really eye-popping facts and figures from the report so that you can share them on social media with your network and make sure that people know about what United Health Group is doing. It has instructions on how to write an op-ed in your local paper. Op-eds and letters to the editor in your local paper are such a valuable way to educate your community on what is happening. And as you saw in the map and in the list, United Health Group has subsidiaries across the country in almost all communities out there. So an op-ed in your local paper is going to be very relevant to people in your town. You can also call your members of Congress. We have set up a call tool that will walk you through how to call your members of Congress. It'll dial them for you, and it gives you a script to ask them to co-sponsor the Patients Over Profits Act. It also walks you through how to meet with your elected officials. And even if you've never met with them before, this toolkit has information on how do you set up a meeting, how to prepare for the meeting, and how to conduct the meeting and how to follow up. The toolkit will also have a recording of this webinar that we are encouraging you to share with anyone and everyone you think might be interested. Finally, the toolkit will also have our email address, which is down below, that you can always reach out to. If you have questions, if you need help in your advocacy, we are here to help. We want this report to be something that people can take, look at the United Health Group subsidiaries in their area, and then use it to take action to improve their healthcare locally and nationally. So, what comes next? What are those immediate action steps that you can do right now? As I mentioned before, as soon as you get the email from us, you can call your members of Congress. It will have you call your House representative and both of your senators, and you can urge them to co-sponsor the Patients Over Profits Act. The deadline for initial co-sponsors is September 9th. However, if you can't get your members of Congress to sign on by then, they can always sign on after introduction. You can also educate other activists and share the recording of this webinar because if you're here, you now know that United Health Group is connected to every part of the healthcare system and the health justice fight. So please share this with anyone you think might be interested. Now, a little bit later, we will be having a virtual activist meeting. This will not be a webinar. This will be a meeting where we can talk a little bit more about further concrete action steps that folks can take. And further down the line, we will get you linked up with other people in your area, again, so that we can really, as a movement, start to make the change that we want to see in the healthcare system. And so I'm going to hand it over to Joey, who is going to take some questions from the chat, and we will all answer them as best we can.
Thanks, Rachel. So a lot of questions have come in. We're not gonna be able to get to all of them. We only have time until 9:15 p.m. Eastern, but we've gotten a few MLR questions, so I'm gonna consolidate them and not all consolidation is bad. We're going to consolidate them into one question. Can you be specific and give an example of how MLR is gamed to provide more profit for vertically integrated companies like UnitedHealth Group? Wendell, Seth, Rachel.
Seth, you want to start?
Sure. One of the ways that it is gamed is there insurers have very broad latitude in terms of what they define as a quality improvement expense. And that's important because quality improvement expenses actually count as medical expense, not administrative expense. And as a physician who's been an executive in both provider and payer organizations, I would argue that the most important quality improvement work actually takes place in the clinic, in the hospital, closest to the bedside and the front lines. And so what is happening is that insurers are taking credit for tens, hundreds of millions of dollars each year in quality improvement expenses and counting that as medical expense. And that's not translating to real care on the ground or support for clinicians. So that's one of the most pervasive ways. But Wendell, any other thoughts?
Yeah, and I might note that what these companies are doing is not what Congress necessarily intended. The medical loss ratio, as you noted, was codified in the Affordable Care Act in 2010, but it was the regulations that were written that gave them this broad latitude to count so much as quality improvement. And the Congress gave the National Association of Insurance Commissioners the responsibility of drafting regulations to implement the MLR provision. And you think these companies lobby Congress heavily. I've never seen lobbying so intense as the lobbying that took place to try to get the NAIC to make that as broad as possible. And they caved in many cases. They didn't win everything they wanted, but they just as an example of how much money these companies spend, and it's our money in lobbying, and not just Congress, but the administration and organizations that are tasked with writing regulations for the federal government.
And just to connect it quickly back to the patient's journey, Stat News recently found that United Health Care pays its Optum employed physicians at much higher rates than they do other physicians. And so what that means as a patient is, let's say that you have United Healthcare, you go see an Optum physician for, your checkup. Let's say United Healthcare is paying physicians that it doesn't own $100 for that visit. United Healthcare could potentially be paying the physician that they own $1,000 for the same exact visit. And what they get to do then is say that they paid for $1,000 worth of medical care, even though they're just moving that $1,000 from their insurance arm to the physician arm. So they're not actually paying that money out. And that was a great stat investigation that found another way that they're gaming the MLR.
And one thing, another point is that by doing this, they're putting independent physicians in independent practices at financial risk. They're underpaying them in many cases and paying themselves more, which is another reason why this self-dealing is so prevalent, why it should be banned in our view. But not only is United buying up so many physician practices, it's putting a lot of independent practices in financial jeopardy, and more of them feel they have no alternative except to sell out to a hospital system or to United Health or one of the other big conglomerates. And there are, by the way, so one of the questions, it's not just United Health. The other big companies have also embarked on vertical integration strategies. When I worked at Cigna, the acquisitions were largely horizontal, buying up other companies in health insurance. But it bought Express Scripts, a big PBM, pharmacy benefit manager in 2018. And it is now far bigger. Express Scripts, or the pharmacy business or part of Cigna, is now far bigger than the insurance component of Cigna.
Thank you all. The question is, How does United influence public policy? Are they standing in the way of passing legislation like Medicare for All? And I'd add on to that, how are they standing in the way of Medicare Advantage reform? How are they standing in the way of out-of-pocket reform and so on and so on? What else?
I'll start. They do it with the ability to influence elections. They make huge donations to candidates, both money that's reported and by funneling money into organizations that they're a part of, like the Better Medicare Alliance, which is an outfit that represents big insurance companies that have Medicare Advantage plans. Lobbying, the dollars that they spend on lobbying is enormous. You can go to Open Secrets and see how much they spend in contributions and lobbying. And it's not just in Washington, it's at the state level as well, too. As these companies get bigger and bigger, they have more of our money that they can spend in this way on campaign contributions and lobbying. They are very intimidating. They can get members of Congress to do what they want in many cases, as well as the Center for Medicare and Medicaid Services.
And I'll just add, as a former congressional staffer, they also fund a lot of studies that appear to be academic in nature. They may even be published in peer-reviewed medical journals, trying to prove that they provide superior care. Those studies are often very biased and not accurate, but they are provided to members of Congress as proof of why we can't do things like stop upcoding in Medicare Advantage or, make traditional Medicare better, things like that. So that is another way that they have been able to influence public policy without many people realizing that they're doing it.
Thank you, Rachel. Thank you, Wendell. Um, how much is United involved in Medicaid?
A lot.
Rachel would answer this.
I'll start again. United is one of the companies that manages the Medicaid program for parts of many, many states. And if you look at United's earnings reports, you'll see that on their health plan side, more than 75% of uh, their revenue now is coming from public programs, the Medicare Advantage program and the Medicaid program, which doesn't get nearly as much press. But it's a big, big cash cow for United and several of the other big for-profit health insurance companies.
And a lot of evidence shows that they are running the same playbook, if you will, that they do in Medicare Advantage when they manage Medicaid. So there have been, whistleblower allegations that there are ghost networks for many of the Medicaid managed care programs, a lot of upcharging, things like that. And I wanted to highlight that Physicians for a National Health Program just published a report showing how much each state could save if they actually took back control of their Medicaid program rather than using private health insurance companies like United to manage that care. The savings are staggering in the billions of dollars for individual states. And so wanted to highlight that because that directly ties in here. United Health Group, as Wendell mentioned, is deeply entrenched in Medicaid. It just doesn't get enough press, but it really should because there's a lot of waste going on there as well.
Thanks, Rachel. What can patients do to fight back against this?
That's a great question. And I would first say pushing your members of Congress to co-sponsor the Patients Over Profits Act. That is such a direct way to stop this self-dealing. And without the ability to self-deal and to increase those profits and that bottom line, this vertical integration would become a lot less attractive to United Health Group. As Wendell mentioned, the medical loss ratio regulations really did lead to a lot of this vertical integration because it was a way to increase profits, to make Wall Street investors happy. And so severing those ties, not allowing those conflicts of interest is a really direct way and a solution that is now going to be on the table. So patients can push their members of Congress to do that.
And I really encourage you to do that. Not only should you know who your member of Congress is, and to encourage your member to be involved in this effort, they should know you. Be a squeaky wheel, and that is important too. If you are a patient who is denied something, and or have a loved one who is denied coverage for medically necessary care, be a squeaky wheel. And I know from my years in the industry that that makes a difference.
Here's a question. What if I was once a United Healthcare patient but no longer am? Does United Healthcare still have access to my current data now that I'm with another plan?
Oh, yes. They probably know more about you than you know about you. The amount of data that they have on us, uh, these businesses that they own and operate, they sell their services to other health plans. So there's a lot of information that that company has on all of us, regardless of what health plan we are enrolled in. Even if we never were enrolled in a United Health plan, it truly is a company that has influence over our lives from cradle to grave.
Thanks, Wendell. Um, you had touched on this earlier, but the question is, self-dealing is illegal in the banking industry. When will it be illegal in the healthcare industry?
It needs to be soon. I'll let Rachel talk about that because there is interest on Capitol Hill, actually in both parties. There are Republicans who are very concerned about the anti-competitive nature of this industry. There are Democrats who are very vocal on this, and uh, this goes back to what we were saying just a moment ago. It's really important for y'all to be vocal on this, to encourage members of Congress to tackle this, to tell them how outraged you are that this is going on when it's not even legal in other industries.
Definitely. And I think one important piece of this is in other industries, it was more obvious when that self-dealing was occurring. But because the healthcare system in the US is so complex to start with, a lot of this self-dealing has been invisible to providers, patients, and even policymakers for a very long time. And that's where we're hoping this report will come in to shed some sunlight on what's happening and to get the information out there so that we can change how our healthcare system functions. And Wendell alluded to this before, but the vertical integration of healthcare is a fairly recent phenomenon over the past few decades. Many of our regulations on health insurance industries were written years and years ago. So we do need to update them now that this self-dealing is happening. And that's where everyone on this call comes in to educate your members of Congress and just members of your community about what's going on and why we need to stop the self-dealing.
Thank you. Where does AARP fit into all of this?
Well, AARP has been a partner of United Health for some many years now. It's hard not to notice, certainly when open enrollment commences, and it will in a few weeks. We'll be seeing ads by AARP and noting that they have an affiliation with United Health Group. They, in my view, need to step up and be more vocal and transparent about their relationship with this company. We know that they, over the years, have taken in billions of dollars from this relationship. It's a very lucrative one for AARP. They occasionally will weigh in on some issues pertaining to the need to reform Medicare Advantage, but they're not all that visible. And I think that's a failing of theirs. And I would certainly call on them to do more and to assess their relationship with a company that is under such scrutiny right now.
And I would just add AARP, their partnership with United Health Group is part of the effort that we talked about before with the UHG funded studies, the Better Medicare Alliance, trying to create a trust around Medicare Advantage using trusted partners You might see it in Medicare Advantage commercials that use celebrities or sports stars, things like that. It's trying to create this trust so that seniors and people with disabilities feel that they should enroll in the plan, despite all of the obstacles, because they're never going to say what they're really going to do when you join the plan, which is prior authorization, step therapy. In those commercials, they're trying to create the illusion of trust. And I think that's one part of the strategy.
Thank you. Probably time for like one or two more questions. How concerned should providers and physicians be about retribution from United Health Group if they publicly speak out against them?
Well, it's a concern. We just published a piece this week, I think today, about Dr. Elizabeth Potter, a surgeon in Austin, Texas, who I think Austin, I know in Texas, who um, went viral when she posted a video after she was called out of surgery by a United representative with a prior authorization query. And Dr. Potter decided to go public with this, and she got soon heard from a lawyer from United Health Group asking her, telling her to pull that video down. She didn't. She's been continued to be very vocal, but she's saying that in her view, she's being retaliated against. That United is not allowing her surgery center in network, and that is penalizing her financially. And on United's earnings report earnings call a few weeks ago for the second quarter earnings, they said the executive said that they plan to reduce the size of their provider network. So you can it seems as if there is an effort to retaliate, and I think that as Dr. Potter pointed out in this story that we published, uh, it's having an effect. More and more doctors are hesitant to speak out because they need to be in network or they are already owned by a hospital system or an insurance company. So their voices, sadly, are apparently being muzzled.
And I just wanted to add, if you are a provider and you do want to be involved in the fight against United Health Group and towards a better healthcare system, but you're worried about speaking out publicly, feel free to email us in the email that we put in the PowerPoint, and that will be in the toolkit, because there still are ways that you can be involved even if you don't want to publicly speak out. So we are more than happy to help you stay involved.
And when I said we published, I'll give a plug for Healthcare Uncovered, which is a newsletter that we publish.
Thank you, Wendell. Well, on that note, we're just over time. Be like Dr. Elizabeth Potter, be like Andrea Kim, and get out there and fight. It's worth it. So thank you all for joining us tonight. It's a pleasure and it means the world to our team. So thank you. Have a good night.
Good night.